Hello everyone. In today's video, we will learn about one of the important viruses, that is dengue virus. So, it is an arbovirus, which means it is transmitted from one host to another through the arthropod vectors. Particularly, dengue transmits through the mosquitoes. So, dengue virus belongs to the family of Flaviviridae. So, it is an enveloped virus. It contains single-stranded RNA. So, all the arboviruses are RNA viruses. So it causes the infection called dengue, which is characterized by fever of sudden onset, headache, retrobulbar pain, which means pain behind the eyeball, conjunctival infection, pain in the back and joints. That's why it is also called as breakbone fever. Then there may also be lymphadenopathy and maculopapular rashes. So these are the characteristic clinical features of dengue infection. So dengue is endemic and often epidemic in tropics and subtropics, particularly in Asia, Caribbean, Pacific and some areas of West Africa. So in India, dengue infection is most commonly seen and particularly in the East Coast. So dengue virus has mainly 4 serotypes, that is dengue 1, 2, 3 and 4. So recently 5th serotype is also discovered. So there are mainly 5 serotypes of dengue virus. So dengue virus, it is mainly transmitted by a mosquito, which is primarily Aedes aegypti. So here vector for transmission of dengue infection from one person to another person is a mosquito called Aedes aegypti. So these mosquitoes bites the host during the daytime. So what is the pathogenesis of dengue virus infection? So there are two types of dengue virus infection. So first one is primary dengue infection and the next one is secondary dengue infection. So primary infection with the dengue virus occurs when a person is infected with dengue virus for the first time with any one serotype. So as I have already told, there are 5 serotypes of dengue, right? So initially, if a person comes in contact or bitten by a mosquito which is infected with any one serotype of dengue virus, he gets primary dengue infection. So the same person after months to years, if he is getting bitten by Aedes aegypti mosquito which is carrying another serotype of dengue virus, then he will get more severe form of infection, that is secondary dengue infection. So understood, right? So primary dengue infection means initial infection with the any one serotype of dengue, whereas secondary infection means after several months or years, same person is getting infected with another serotype of dengue virus. So antibody response against dengue virus. So infection with dengue virus induces the production of both neutralizing as well as non-neutralizing antibodies in the host. So when a mosquito, that is Aedes aegypti, carrying dengue virus bites a person, the virus enters along with the saliva of the mosquito. It enters primarily into the skin, and after entering into the skin, it directly reaches to the bloodstream, right? So in the bloodstream, it enters into the white blood cells and it multiplies inside the WBCs and it moves throughout the body through the bloodstream. So in severe infection, virus production inside the body is greatly increased. There is active multiplication of the virus inside the cells, and through the blood it enters into various organs like liver, bone marrow, and these organs are also affected. So because of the presence of this virus in the cells of the host, so there will be blockage of small blood vessels. So as a result, there will be less blood circulation in the blood vessel and the blood pressure will increase. So sorry, not increase, the blood pressure will be decreasing. So blood pressure becomes so low that it cannot supply enough blood to the vital organs like brain. So dysfunction of bone marrow leads to reduced number of platelets, which increases the risk of bleeding and other complications of dengue. So here, reduction in the number of platelets is the main symptom of dengue virus infection. So coming to clinical features of dengue infection. So there are two forms of dengue infection. First one is classical dengue fever and next one is a serious form, that is hemorrhagic manifestations. So classical dengue fever, all of you know about the general symptoms of dengue infection. So which includes abrupt onset of fever, maculopapular rashes over the chest and upper limbs, frontal headache, muscle pain, joint pain, lymphadenopathy, retroorbital pain, loss of appetite, there may be nausea, vomiting, etc. These are the general symptoms of classical dengue fever. So the next one is more severe complication, that is hemorrhagic manifestations, like there may be dengue hemorrhagic fever or dengue shock syndrome. So these manifestations are mainly seen in the children of 5 to 10 years of age group in areas where multiple dengue viruses can cause the diseases. So basically there is hyperimmune response here because of the previously infected serotype of dengue. There will be already antibodies formed against that particular serotype, right? So if the same person is getting infection with the another different serotype of dengue virus, what happens? The antibodies formed against the first serotype of the virus, which is already present, it reacts with the second serotype of the virus, forming immune complex, that is antigen antibody complex, that is or virus antibody complex, which leads to most severe complications. So initial symptoms will be similar to that of the classical dengue fever, which will be associated with the hemorrhagic rashes, thrombocytopenia and shock. And in this case, the mortality rate will be 5 to 10%. And next we will move on to laboratory diagnosis of dengue infection. So to diagnose the dengue infection, mainly the serum sample can be collected because it is a blood-borne virus, right? So mainly it is transmitting through the blood. So first one involves most commonly done test to diagnose the dengue virus infection will be dengue NS1 antigen test. So it is basically a rapid card test. Within 20 to 30 minutes we will get the result. So it is based on the principle of ELISA or immunochromatography. And antibody detection we can do by MAC ELISA or neutralization test. And next one is virus isolation, which is not commonly used for diagnosis purpose. It can be mainly used for research purposes. So here mosquito cell lines are used. And the more specific method will be molecular method, so which involves real-time RT-PCR. So here one more important thing is that in antibody detection we can detect both IgM and IgG antibody. So if IgM antibody is detected, it indicates the acute infection. If IgG antibody is detected, it indicates chronic infection or past infection. And the last part is prevention of dengue infection. So we all know the preventionary measures of dengue infection, right? So mainly the vector control measures, that is mosquito control measures like usage of insecticides, wearing protective clothing, removing the... Hello everyone. In today's video, we will learn about one of the important viruses, that is dengue virus. So it is an arbovirus, which means it is transmitted from one host to another through the arthropod.